Hi, a very warm welcome to all of you from Bharat Dental Show. What makes someone leave everything familiar, build a life abroad, and then choose to come back? Leaving home builds your wings. Coming home tests your roots. Today's conversation is about reverse migration, not just of geography, but of identity. When you train and practice in a system like UK, what do you bring back? What roots call you back home? And what wings did you grow while you were away? Our guest today has lived that a full circle. Welcome to the podcast synergy of Roots and Wings, Crossing Borders, Coming Home. I, Dr. Manali, Organizing Secretary of Bharat Dental Show, and Dr. Saloni, Organizing Chairperson, are the moderators for today. And we are talking about the bravest journey of all, the one that brings you back. I would request Saloni to say something.
Greetings from Bharat Dental Show. This unique podcast synergy has been crafted by myself and Dr. Manali Mehta, and this is specially to give a live experience by actually talking to all those who have decided, who have their roots in India, educated in India, and then gone abroad, explored their potential abroad, made their base abroad, and sometimes come back. Well, we've already finished 2 podcasts, where one who has changed profession, the second one who has found her base. And here we are today with Dr. Aditi, who has gone and explored her potential, experienced, got the expertise back to her roots in India. We welcome you, Dr. Aditi Shetty, today for this podcast, Roots and Wings, a synergy podcast of celebrating global Indian voices.
Thank you so much. Thank you, Dr. Manali and Dr. Saloni, for having me today. Thank you to Dr. Manali to think of me and include me as part of something. What seems to be you guys are doing some great work, and I'm very excited to see what more you guys will be doing as well.
So, introduction for Dr. Aditi Shetty. Our guest today is Dr. Aditi Shetty. She's a specialist prosthodontist. I have known her since 2011 as a teacher and as a mentor for Integrated Clinic, which I had forgotten, but she reminded me that. Dr. Aditi Shetty,
will never forget that.
Yeah. Dr. Aditi Shetty did her BDS in Navi Mumbai from D.Y. Patil University and then crossed borders to Edinburgh for her doctorate in prosthodontics and fellowship from the Royal College of Surgeons. Today, she's back in Mumbai as a consultant prosthodontist at Opus Dental Specialities and Dalal Dental Center, bringing UK-trained precision to Indian smiles. She also is a guest lecturer at the Ajman University, teaching the next generation for the FRCS Edinburgh. Her expertise is digitally guided implants, full arch rehabilitation, CAD/CAM dentistry, smile designing, and minimally invasive restorations. Dr. Aditi crossed borders to learn. She crossed them again to teach, and she crossed them once more to practice here at home in Mumbai. I welcome Aditi to the podcast of Crossing Borders and Coming Home.
Thank you so much, guys. Thank you so much for having me. Thank you.
So Aditi, before we decide about what you did in UK and how you explored your base in UK, what were the values of India in terms of education, family, cultural competence, all the values of India that kind of gave you an edge to establish yourself in UK? Could you please give us your opinion and your experience regarding the same?
So, one of the first things that I would like to point out is that whenever we as Indians go abroad, we are usually always the youngest. We're always usually the most inexperienced ones, because we're lucky in a lot of ways that our families tend to support us. And they help us with the financial aspect of it. So it's usually that the Indians or the South Asians, moreover, are always usually the youngest. That has its pluses and minuses. But I think for me, I just had 1 year before I went. So I completed my internship in 2016, and 2017 September I joined my doctorate. My plus was that I was just an open book. I was just there to absorb whatever I could, and however what I think we as Indians have is because we do have a lot more respect for the institution, as well as for our mentors. So what I have realized is that we as Indians tend to absorb a lot more because we don't go in with any sort of any preconceived notions. We don't.
You have an open mind to absorb.
We have an absolute open mind.
Got it.
And we also we're not set in our ways, so we tend to absorb a lot more, and as I said, respect for the institution, that's something that's ingrained in us.
You're very grounded and you have a lot of respect
for our elders, for people more experienced to us. So that really brings in another equation as well. When I look at when I looked at my colleagues, I think that was what was the differentiating factor for me. And of course, there was a lot going on. It's the first year, you're just so overwhelmed. You're absolutely overwhelmed because you are just, by the time you try and find your footing, that's a year just gone right there. But I think it's just keeping up with the pace, and I think I think if it were anyone else in my shoes, I think they wouldn't have been able to do as good a job, considering our values and the way we've been raised. So I think that's definitely a plus coming from India, for sure.
What pushed you to practice in UK? What was your struggle with your licensing and your training over there?
One of the biggest struggles, the reality and the truth of the situation is I don't know where I would have been had it not been for COVID, in all honesty, because I graduated just when COVID was at its peak. So I don't know where I would be if I would have been in the UK or come back to Mumbai. I have no idea 5 years down the line. But as fate would have it, I'm back here now. But one of the biggest challenges that I had was also, I think there is a bit of a gap in the undergrad curriculum as in the UK and in India. I think in India we take our time updating the curriculum. So the biggest thing was bridging that gap between what was expected for us to know and what I ended up knowing. So I remember one of the in my first 2 months that I was there, I had no surgical experience at all, because in BDS we don't cover surgery. So, but I was kind of expected to know surgery, and that was, a gap. So I went to one of my consultants and I just asked him, I said, can you just give me a case where I just have to reflect a flap, nothing else, just reflect a flap and do an apically reposition flap and just do a subgingival debridement like that. Just give me that. He just looked at me and he's like, we're not here to teach you basic dentistry. And he just walked away. And I remember coming back and just bawling and crying, because I think that was, for me personally, that was a very big challenge. As well as a challenge for me, I remember in my second year was kind of standing up for myself. So I realized towards mid-second year that I was not getting as much as some of my colleagues were doing. So I wanted to do a lot more implants. I wanted to do a lot more full mouth rehabs. And I was not getting that. And I remember struggling with standing up for myself. And
I just want to interrupt you, Aditi, that have you given a licensure exam before you went to UK? So just for all those who want to probably aspire to go to UK, could you just take us to the journey of how did you go to UK and how did you start? Were you doing an educational curriculum, or were you doing some degree, or were you doing some licensure exam? That's something which we would want you to walk us through.
Sure, I can just so in the UK it's a bit simpler than in the US. One of the disadvantages, of course, is that there are much lesser institutions, especially giving you having a master's program for your particular specialty. So I think in the UK, pros, there are only 3 institutions, I think, that provide you with a 3-year prosthodontics program. So the basic requirement is, of course, your IELTS. You have to have a good score.
IELTS.
Yes,
Okay.
your IELTS. So you have to have a good IELTS score, and there is a minimum 2-year work X requirement in almost all institutions. So initially, I got into a 2-year program, which was also an MClin, which is a master's in clinical dentistry. However, that would not have allowed me to sit for the specialist exam, which is I would not have been able to become a member of the Royal College of Surgeons. To become a member of the Royal College of Surgeons, you need to have a minimum 3-year degree. I wouldn't have been able to sit for. So I first got into the University of Newcastle, which was a restorative program, and then I was fortunate enough to get into University of Edinburgh for the 3-year program. So one advice that I would give to aspirants is definitely, if you are able to, go and visit the universities, because the impression you make in person, you will never be able to you won't be able to put yourself forward online. So
go into a Reiki of the universities, and then you check.
Interact with them before you join.
Interact with them, yeah.
Interact with them.
For your sake also as well, right? You should know what you're getting into. Go and see the facilities, see what's out there, see what's available for you. Because had I gone to Newcastle, I definitely wouldn't have gotten the exposure that I got from going to the University of Edinburgh, just because of the facilities that was available, the infrastructure, the fact that the University of Edinburgh was a secondary care NHS hospital, so only complex cases were coming towards you. You were not wasting your
able
time
to practice, means it's the 3-year course that you said that you joined a 3-year, which is a specialty of prosthodontics, because you were a master's in prosthodontics here itself. And that was your ground, educational profile with what you went, right? So, and then you took over the 3 years of course curriculum there.
70% of your practice is clinical, completely clinical. So you don't have to do a licensure exam. You need to do a licensure exam once you're done. If you want to practice in, say, private practice. But in order to practice in the hospital, you do not need a licensure.
They allow you to treat patients.
They allow you to treat patients. You basically are covered under the registration of your consultants. So you get a temporary registration of sorts from the NHS. But you're only confined to practice within the hospital premises. You're not allowed to practice outside of the hospital. Yeah. So that's one of the. So the process is not that complicated on paper, but however, getting into a good university, I would suggest just going and doing your recon and just making sure that because everything can look very rosy and great, and that's how I thought when I got into Newcastle, and I was set on it. But once I visited, that's when my mind changed, and I decided to go to Edinburgh instead. So I would definitely recommend everyone, if they could, to definitely go and because that'll change your mind and your worldview of what.
There was no theory exam or nothing. You just give your IELTS score, and then you apply to universities, and then you suggest that you should go and see the universities, and then exactly which one would you want to enroll in, right? That's right.
So yes. So if I'm not mistaken, though, I think King's College does have a bench test that you need to give. But I think, if I'm not mistaken, it depends from department to department. So I think, at least for Endo, I know that they do have some sort of a bench test that you need to give. But other than that, there is no other paperwork or stipulation. It's just your typical your SOPs and your cover letters and recommend all of that. Yeah.
What was that one moment that you felt you need to come back? after doing so much there, then why did you think of coming back to your roots?
So another big thing was, of course, COVID happened, but also towards the end, I think COVID changed a lot of people's mindsets, because being confined in a tiny little place with not much support and family around you, it changes what you prioritize and what you think are important. So definitely, I think it was just family and your community around you that for me that made a difference about coming back. I was definitely nervous about what things, but I was also very excited because I felt like I could contribute to the community, to the dental community, and be able to bring whatever little expertise I collected over the years to be able to, come back and kind of work and practice in my own way. And I think over the past 5 years, I think I've done a pretty good job with, continuing to work the way.
So, and when did you come back, Aditi? So like you decided to come back, I think during COVID, or when COVID was COVID?
Yeah, so I started in September of 2017, and I came back in Jan of 2021.
Okay,
So
and then since then you have been in India. So what was what you learned when you went to the UK, and that wings of experience when you crossed borders, you went to UK and then you've come back to your roots again. So how was Aditi different in the way she probably treated her patients, in the way she thought, in the way she kind of implemented? What change did Aditi have then?
I think the biggest change that I have seen in myself when I approach a patient is looking at the bigger picture. I think it is more about a single tooth, a single diagnosis, a single treatment plan. I think it is, yes, addressing the patient's chief complaint is very important and paramount. But I think factoring in every single equation, whether it comes to a patient's medical history, their past dental history, patient's habits, everything from not having a tunnel vision when it comes to my specialty, because I think we tend to do that. We as prosthodontists, tend to look at it only as a prosthodontist. But the great thing about doing a program that I did was that if I did my full mouth rehabs, I did everything from perio to endo that the patient needed. I did it all on my own. I did not refer it out to anyone. So any restorative work, of course, very complicated cases like calcified canals or very complex perio treatments were referred out. But otherwise, everything was done, I had to do on my own. So I think that really made me look at it from a different perspective, and ensuring that I don't have tunnel vision when a patient comes in and walks into my practice and sits on my chair. I think that's one of my biggest takeaway, because I think patients appreciate it as well. They see that, you're looking at it holistically, you're looking at it from a bigger picture. And not
multidisciplinary vision, I would say.
Yes.
And from that one doctor, otherwise we are referring to, a periodontist, an endodontist, and a surgeon. I believe you got your surgical skills touched up as well, so, that one person who had it all, right? That's right.
I mean, the moment I touched back into India, I stopped doing endo completely. And I have no regrets about it at all. But my diagnostic skills, I think, have become so much better because I did the endos myself, because I did the perio myself. I know what to look for now, and it's not a problem that I need to deal with later on, or do my treatment first and then have a complication come up because it's not my specialty related. So I think that's one of my biggest, which I'm very thankful for when it comes to my my education. I think for sure that is something I practice on a daily basis. So even if it's referred out, I make sure that I refer it at the right time and not kind of backtracking and trying to kind of just like
Sleep over it and just have be like proactive and get that treated first.
Exactly. So I think that is what I practice every day right now, and I'm really, really thankful for my background from this particular aspect as well.
So a lot of people still hesitate, coming back. So what is that one myth about returning back to your roots that you would like to break?
See, I'll look at it from my perspective as well. My biggest worry coming back was that, Bombay is saturated. Bombay is very saturated. We have more graduates coming out than, the diaspora of patients that we're looking to treat. So that was my biggest. But I do believe after practicing for 5 years now, and if you asked me this 3 years ago, I would not have the same opinion. But I definitely, what I would say is if you do decide you want to come back, the biggest thing is patience. I think
I was going to say that, Aditi. Have the patience and the faith, right?
Have the patience and the faith. I wish I could tell myself this 3 years ago.
Yeah.
But you're going to tell all those who are...
Tell everybody that.
Yeah. Just have patience and stick to your guns. Stick to your guns. There are going to be a lot of situations where you're going to feel like I should just give in and not, treat a patient the way I believe the patient should be treated. Take the easier route because the patient asks for it, but just stick to your guns. If you believe ethically that this is how it should be done, then just stick to your guns. Trust me, it'll take some time. You'll lose some patients, but those patients themselves will appreciate it and they will come back to you because you were true to yourself. So I think that is one of the biggest challenges that I think we as clinicians, when we think about coming back, that's our biggest worry. But I think after 3 years, I can say for sure that I have a long way to go, 100%, but I see the light at the end of the tunnel now. And I do see, I see the little community that I'm building right now. And biggest thing is just have faith in yourself. Just believe that, it's going to work out. And it does. You will find your little place.
That's a lovely, lovely message that, is something, because it's not just for just this, but it's for every single thing, that you have the perseverance, you have the faith in yourself, you dedicate yourself. And I'm sure that, it's like you keep watering the seed and one day the plant will grow. That is also being the soul of Bharat Dental Show, in fact. The seed that we have sown, and we are like, roping, having everybody in, like having this podcast and webinars and case presentations. So you just keep going. The faith has to keep going, and the growth will continue.
Hard it is, and also mentally, it can be very difficult. It can be very, very difficult on you, because you're just like, because sometimes you're like, oh no, what have I done? Like, have I made a mistake coming back?
Absolutely.
Have I just completely derailed my career because in the moment I felt like, oh no, I should be back home with family.
Sure, we have those dark moments. Yes, absolutely.
Yeah, because you're just like, wait, have I just left the golden goose back in the UK and come here?
I'm sure you wouldn't be saying that anymore now.
No, I don't. It's not like everything is, I am where I want to be.
You will, yeah.
But I do see that I do find, whatever, even if it's a tiny little community, I do see a small community being built.
And the kind of service that you're giving, as I said, that multidisciplinary approach, that, that thought process of giving such a golden standard of care with the kind of what you've learned is something so promising and something so giving. And that's what is the main motto of what we are here today, isn't it? To give back what we've learned to that's what is the most important thing.
That's what all of us would want to do, like, learn and give back to whatever.
Give back, because it's just amazing to see when, there are these, and of course you guys
are. Smile on your face says it all, Aditi.
No, but I know you guys have been teaching for so long, and Dr. Manali is one of the reasons why I became a prosthodontist.
Perfect.
She and Dr. Omkar Shetty are the two reasons why, because pros was like a complete enigma to me. It made no sense whatsoever. It's only because of these two that I am a prosthodontist. And we were just discussing how the initial four people who were part of the IC program are now all prosthodontists. So I don't think that's a coincidence.
Yeah. Such a pleasure having you on board, Aditi. Really such a pleasure.
No, absolutely. And I love what you guys are doing, and I'm really, really excited to see what more you guys will, and see in whatever way I can help out as well. I'd be very, very happy.
You're absolutely on board, Aditi.
You're on board with us, exactly.
Great. I'm so happy. I'm very happy. Thank you.
Thank you so much, Aditi. Your journey actually reminds us that roots aren't about being stuck and the wings aren't about escaping. Sometimes the bravest flight is the one that brings you back home. Change. Thank you for showing us what it means to carry both the worlds with grace. To our listeners, what route is calling you? What wings are you ready to use? Reflect on that this week. Thank you once again, Aditi, for being a part of our podcast Synergy. It was a pleasure to have you on board.
And
thank you so much, doctors. Thank you. We'll be meeting soon.
We'll be meeting soon.
Thank you.
Thank you. Bye.